Yo, how are you doing, folks? Welcome to another recording here on day 3 of Product Earth. I think this is number 8, number 9, maybe. I haven't really kept track, didn't write anything down. Anyway, I'm joined by a gentleman here who's been quite a journey to arrive at where he is today, but I'll let him introduce that further. He is Mr. Tim Henley from Access Kaneh.
Hello, Simpa. Thanks very much for that.
Could I ask you to talk as close as you can to the mic, because we have got
my voice
a bit.
is very loud.
It does. It carries well, but we've also got quite a lot of noise with the quite well-attended expo we're at.
Absolutely. It's been really interesting, actually, to see it change. This is my third one, and it's changed throughout its time, and it's evolved. And I've been to cannabis, so let me kind of say where I come from, the journey that I've been on, and the transition that's happened in the industry that's moving forward. So effectively, I started out in 2016 with a CBD brand. My wife and I kind of imported CBD from the USA. CBD was this thing that was just starting out. At the time this was all going on, my nephew started a PhD at Aston University, and that PhD was looking into CBD and epilepsy. I knew nothing about CBD, and I was a manager. I then found out it was a cannabinoid, and that started that whole journey. It transpired that PhD was sponsored by GW Pharmaceuticals, and it was part of the evidence protocol for Epidiolex and its marketing authorization. There's a whole story behind that, but we won't go into that. And it's kind of, that is the initiating kind of phase that started my journey. From doing that, I became a founding director of the Cannabis Trades Association, which formulated in a response to the MHRA's viewpoint that CBD was being advertised as a medicine. So this thing about Epidiolex and marketing authorization is the fact that the MHRA issue marketing authorizations. That means you can make medical claims once they have certified that a product is good for what it says on the tin. Now, it costs enormous amounts of money to do that. They're highly kind of involved systems of analysis, and CBD's never been in that position. The only company that's ever achieved it is GW Pharma, because of the stock market listing and the casting stuff. Several companies are in the progress of doing that now, but moving forward, the whole kind of thing about CBD was a spearhead that made cannabis more acceptable to more people. It started a transition change, which has actually cascaded, but the domino effect is carrying on and gathering speed as we speak. And that brings us back to Product Earth. When Product Earth, the first one I went to was in Birmingham, and it was a very kind of low-key affair, and this is much more kind of in the range of cannabis moving forward. And I think that it will grow and develop as the industry grows and develops. Now, I think we have slightly different viewpoints on where the industry is and what it's going to do. But my point of view is everybody needs to make a living, everybody needs to make money. The industrialization, the business orientation of cannabis is an inevitability of turning it into a commodity, a product, which is what it is. It is going to be something that is consumed. Now, currently, CBD is a non-controlled drug. There have been regulations on the novel foods issue, which means if you ingest it, it now has to come to these standards. Moving forward, the whole thing about medical access to CBD, which is where I am now. I'm in medical cannabis, so you can get a prescription for medical cannabis in this country if you have a pre-existing condition that is older than 3 months. Treated with market authorized drugs, that MHRA thing again, that it has to be market authorized within 5 years. So if you can meet those 2 criteria, you are now eligible for medical cannabis. Obviously, currently it is only private medicine. The NHS still does not see the benefit, but there are some real kind of grassroots changes that are happening at the MHRA which is where they are talking about the green prescribing revolution, especially for pain. Now, their kind of thinking there is that green prescribing is about not prescribing people drugs that are for pain control, but actually getting them to be more active, to go out into the countryside more, and to use antidepressants, which I find really surprising. But that is the way it goes. Now, if you put those two things together, the best drug for that, in my opinion, is cannabis.
Yeah.
But they still say there isn't enough evidence.
Well, I mean, we're in a position where it's accepted evidence, isn't it? It's ultimately there is enough anecdotal evidence of this going back infinitum into human history. We have enough studies and metadata that has been collected from places like Israel, Australia, America. The issue is that, I suppose it's where we stand at two slightly different viewpoints of this, is I understand the necessity of venture capitalism to be involved in the birth of the industry and the creation of it. What I am frustrated by is the then pay-to-play mentality that almost arises from it. That if you can't afford your script, you can't get your protection. You don't get the legitimacy of going, you're a patient, not a criminal. And I think that the kind of binary dichotomies that have unfortunately arisen because of oversimplistic marketing, advertising campaigns, whether it be like the non-psychoactive versus psychoactive cannabinoid, the good versus the bad one, hemp versus cannabis, all of these kind of, they're easy marketing tools. So they can take the naive consumer or the potential end user and mold them into a certain worldview that makes your product far more palatable and preferable than another one. And I think that this is what I worry about with the data and the information, is that if it's then being utilized by big business, as it were, to create patented, profitable products, then we don't really get that information. So there may be all these studies, but it's against the nature of the company to make that open source, if it's to the largest sense.
To a certain extent, I agree with you, but I think that the way that things are moving is that there are patient registries formulated like T21, there are other study groups that are moving forward, and it's a collection of data. We talk about citizen science now, it's used all the time in astronomy. We can use that in cannabis. There are devices. So the company I represent now, Access Kaneh, we're working with a company via vaporizers. Now that vaporizer actually monitors how much you consume. It will tell you how much THC, how much CBD you've consumed. You scan it into a QR code, it goes into your phone, so you then start to take control of your consumption and monitor the benefits, because it asks you for, once you've consumed your session, how have your symptoms changed? Have they improved? Now, on one individual case, that doesn't give you enough valid data to do anything, but across crowdsourced data, that volume starts to create patterns.
Obviously, but then again, we passed the point where I think it was Eric Schmidt came out, it'll be over 10 years ago, maybe even 15 at this point, and said the data is far more valuable than oil. There is no physical resource that can match that of this digital resource. And so what worries me is, again, it's metadata collection. It's not even so much of what we do with it now. It's that we are creating far more every day than we have ever recorded in human history. And yes, information is good to inform decision and to allow for the creation of experimentation and vigorous testing that gives us answers and can vindicate certain theories while invalidating others. If that is then done for the intention of not learning about the thing, but to prove a product's efficacy or to prove a theory that would benefit your business model, then we're not really creating that open source. So, I mean, is there, obviously from your side, I'd hear the term of it, but your side of the fence, from within the industry, I'm trying to obviously burn the division down and show that there is commonalities. But do you see any push from any side of, I mean, I call it the medical cannabis industrial complex, not necessarily to cause fear or whatever, but it's a nice encapsulating term that shows the proliferal industries that are now being formed around this beacon, as it were, and it's becoming a huge complex. Within that, is there moves for people wanting to share this data for the betterment of the knowledge at the grassroots level or at the consumer level?
Well, I think that's where device generated information is uniquely independent. If I'm a company and I produce a product, then I want to make sure that the money I spend, and to do this kind of science costs money. And that's intrinsically the problem, that to get standards. So we're talking to the MHRA. Now, surprisingly enough, the MHRA are developing, well, it's probably not surprising because it shows you how far medical cannabis has come. The MHRA are developing monographs, which are the technical standards that are for the import, the production, and distribution of cannabis. And effectively, what they talk about is the microbial content levels of cannabis, the pesticides that are being used, the microtoxins that are in it. So these standards that you will never get from, let's call it the illicit side, will be standardized at a level. Now, surprisingly enough, it also has been done at the European level. Even after Brexit, where I thought we would go off and do the Australian or the Canadian, we're doing it with the European medical agency. So it's kind of this thing, but there is going to be this standard. Medical cannabis is here to stay. Now, medical cannabis, for me, in its widest possible access. So the UN recognized a thing called burnout, which is where you are in a society that is basically burnt you out. That is a medical condition. Now, you currently can't go and get a prescription for medical cannabis based upon that because you've not had 2 market authorized medications before. But that is a guideline. It is not a legislative requirement. So, the more go-ahead consultants, the bravest of the brave consultants, and believe me, the consultants that have gone into medical cannabis now, they put their professional reputations on the line. They've led a kind of charge into this area where, and I'll give you the example of my brother. He's a professor at Bristol University of neuroscience. And when I started talking to him about medical cannabis, he said, well, I'll just make a pill that will boost your anandamide and 2-HT. And I said, well, they tried to do that. A Portuguese company tried to do it. They did the trials in France. 1 person died, but 5 were life-changingly injured. So it's not quite as easy to make this.
Yeah, we've known this for a while. Obviously, companies like Pfizer and Co have been working at this for a long time. With synthetics, most of the modern compounds that became K2 and the modern spices, they came from pharmaceutical labs. So this is what worries me: is the attempt to patent nature, is to create exclusivity, is to create scarcity. And I think that is the traditional pharmacological model in one way. It is obviously the symptom management. And this is what again I worry about the medical cannabis industrial complex, is it's trying to create bespoke treatments to manage the symptoms of conditions rather than looking at the notion and idea of chronic endocannabinoid deficiency syndrome. This is a term that's been thrown around. It started quite grassroots, it went through academia, now it's in labs and people are going, there is something to this. This idea of the root cause of a degenerative an absence of these endogenous compounds caused by environmental issues and epigenetics, etc. Then the whole plant and then access to it through even just nutrition, of even using it as a complete protein, as the hemp seed oil, for example, or even just get the nutrition at the mass, not including the psychoactive or non-psychoactive cannabinoids. That I think is a larger conversation. I mean, I've been talking for several years, fortifying grains and cereals with low psychoactive and non-psychoactive cannabinoids. Same we do with nutrients. If we look at this like a vitamin, rather than it being a medicine, it's something that's missing. It's like we've just found oranges and vitamin C, and instead of going like, we're going to make oranges into pills, we're just going to eat fruit. And so my side of it is I understand that the need for you guys to be able to create such powerful and bespoke treatments to end epilepsy like that, to be able to target directly Alzheimer's or whatever, that once the condition's past the point of degeneration or it's taken hold in the system. But prophylactic use, I don't think should ever be prescribed. But then it shouldn't fall into adult consumption either. There needs to somewhere be this idea that it's included in our everyday lives in some way. That's not to say everybody should be potted up all the time. but the use of it in terms of the resource and technology will better our health by having less BP and BPCs to the plastics in our diet. You know, we can have cleaner air, cleaner water. We can live in homes that are non-carcinogenic. We can improve our environment with the technology of it, as it were, almost negating the need for the end therapeutic. So I'm not against you guys. Obviously, I've changed my position a lot since we last spoke to you. I've really tried to evolve over these couple of years, start this project and understand that I've been oppositional and I've been kind of stuck in this binary thing of you're medical, I'm adult. Not true. We're cannabis.
Absolutely.
The false dichotomy and the binary, the terms that have set us apart, they are the tools of industry that are then profiting from the creation of restrictive legislation. Whereas actually, the end goal of me saying end the war on drugs gives you everything. Gives the industrialists everything, gives everybody everything, and then still has the legitimacy of being free. I qualify for a medical prescription. I obviously qualify for the criteria of CAN card and other systems, but I refuse on principle because I do not want to be safe artificially if others around me are not. I will defend myself in court. I will speak to the police. I will sit in a cell if necessary because I believe that what I'm doing isn't wrong. The law is wrong. And I take heed from the brothers and sisters and trans community members from the LGBTQ community that we should stand in opposition, not allow that kowtow down to their little changes and their hand-ups. We stand and we fight. Cannabis still needs its Stonewall moments. And that's not to say against each other. That's us against the idea of anyone saying no but this, no but that, no but our basic human rights. You know what I mean? So I've really enjoyed this chat, Tim, and I would actually quite like to get you on a long format one if you'd be willing to discuss the ins and outs of this.
Can I just make a couple of quick points?
Yeah,
I
sure.
think these are really interesting arguments. And you said about the endocannabinoid deficiency. Now, we work with a whole range of different companies across the globe. And one of the really interesting things is we work with a company called Holistic Carry down in San Diego, in California. Now, they had the original medical kind of system. They had the very first that was put in place because of AIDS patients, end-of-life care. And if you're going to die, what the hell difference does it make whether you're going to get stoned? It doesn't make any difference. But what they are seeing now is cannabis hyperemesis. This whole kind of thing where people have overdriven their endocannabinoid system. Now for me, and I will talk about my daughter's peer group. My daughter is 22. Her peer group, 15 people, 5 of them no longer use cannabis because they hit it too hard, too young, too strong. And that is an issue that has created a problem. How do we stop that? My suggestion is, why don't medical access, like they have in Oklahoma, you go and see a doctor, you platform, you have any medical history, you have family, psychosis, schizophrenia, that's it.
Well, yeah, I mean, obviously we know that, I mean, we'll use the government statistics. There's a few of the studies, but Home Office say that 1 in 20,000 people, cannabis consumers, potentially could have a negative consequence that could lead to a temporary psychosis type event. So we know that there's potential issues with that. If we then were to bring into conjunction, say, something like alcohol that kills about 10% of consumers in this, I don't want to do the opposite, like polarization.
I want to ask you one question. Imagine alcohol is illegal now.
Yeah.
It would not be legalized in the way it is now. It would be a different system.
It's true, but the problem is that we either have to have the acceptability of going alcohol, tobacco, and sugar, the 3 things that kill more humans than anything combined, and non-scheduled drugs. So either they come into the schedule and we do what David not attempted to do and was arguably sacked for, and work out the harms societally, individually, the potential for dependency. But then going back to the kind of hyperemesis, thank you. We also have seen some of the research suggesting to that it's actually on the larger scale crops. So it's in markets where they're grown at scale, which means the techniques that are used within cultivation are potentially exposing these plants to materials, chemicals, and compounds that are not then flushed from the material. We're seeing this in the UK that whenever, I try to buy now from the smallest growers possible wherever I go, because we have big problems with Albanians, Lithuanians in this country. This isn't to be xenophobic or racist. It's just identifying them as 2 groups that are growing en masse. They're very successful. They take over warehouses, whatever. got thousands of plants. They drop kilos of this on the street, 500, a grand cheaper than everyone else, on the market overnight. They do not give a shit what they are putting in it. It's make it hard, make it colorful, make them they smell like gassy. That's not gassy, kids. That's chemicals. Do you know what I mean? And so we've seen that stuff like it's what giving you a headache. You can smell it, you can see it. And the industry is trying to get there. The hydro industry are trying to be smart and self-regulate. But ironically, the cases of the big farms in America is the companies are hiding it under the board. So actually in the regulation, they're not declaring plant growth retardants or regulators. These things that are actually only allowed to be used on ornamental agriculture, not for things that are combusted, because when they're volatilized, especially through vaporization, the breakdown of the chemical components make them highly carcinogenic. So there are so many of the things that actually a scaled industry potentially presents more harms. I mean, we look at GW's farm that we've seen on footage on numerous TV shows. We see spider mite, we see mold. You know, I mean, it's not a very good representation of what the craft grower can do. Obviously, the scale of it is difficult, and this is where, again, patented CBPMs come in. The idea of these cannabis-derived medical products designed for human consumption, because then they need a certain standardization, a certain replicability. The nature of cannabis is, even a clone, she'll go, screw you, I'm 3 inches from the light over here, so I'm going to express differently here. So the nature of it means she won't standardize, she won't fit into standard pharmacology. Compounds, novel applications, and certain mixes will. The only thing I'm going to say, as a final point of this conversation until we can talk further, is co-crystallization of terpenes and cannabinoids. The research on this is still obviously very young, but it is suggesting the synergy between the compounds. It makes the shape fit the receptor so much better. It boosts the efficacy. So that I think that we're going to start to see a point where isolates will exist almost as an entry-level wellness, but as you were saying, even CBD, any of the isolate compounds or even built drugs, as it were, cannabis-derived built drugs, they'll fall under the remit of prescription. It'll have to be by the nature of it. If you want to make medical claims, it has to be regulated MHRA. Whereas I think that there will be that line on wellness, sports nutrition, especially as WADA and others move forward. But I'm still always going to advocate and argue that unless we do not stop the criminalization across the board, there will be people that won't fit into a group. They won't go, I don't know how to tell my doctor about it. They'll smoke it and it'll help them. They'll sleep better, it'll regulate their appetite, it'll calm them down so it'll avoid potential domestic situations or things like this. And they'll never recognize it. I mean, Tim, it took me years to go, actually, it does have a therapeutic benefit to me. You know, because I rallied against the idea of being a medicine and that I have to go to a doctor and they have to tell me how to use it. Even though I spent 20 years growing it, not growing it, but 20 years consuming it and being around it and whatever. So I respect you for taking the time to sit here today. And honestly, I look forward to us getting the opportunity.
I leave you with 2 points. That is, 2050, we have to be carbon neutral. That means all of society has to change radically.
Yep.
So the things that you're talking about, that industrial complex, that has to change. They're ripping up the scrapbook on that. It's got to change. And the other thing is we're going back to nature. There is a movement back to it.
Yeah.
I'll leave you with that. Thank you so much, Simpa. Cheers,
Been a pleasure, brother. Been a pleasure.
Absolutely.
All right, folks, check us out, patreon.com/Simpa Life, everywhere Simpa Life. Check out Tim and Access Kaneh. And yeah, we'll put some details in the bio below. Peace and love, folks.
Cheers.